Today, we are highlighting why we are reforming health care this year and why it is important to do so and do so as soon as possible. If we do nothing, the cost of health care for an average family of 4 will increase $1,800 a year. This is a hardship for that family. It's a hardship for businesses. It's a hardship for our economy. It's a hardship for our budget. And so we cannot afford to do nothing. What we are doing is removing the health insurance company from between patients and their doctors.
The Speaker talked about choice, not putting anybody in between their doctor and themselves, but making sure that they can get a doctor, making sure that they can get to a hospital, making sure, in fact, that they can have the health care they need.
For the first 6 months of the year, I pay $85 in monthly premiums. In exchange, I receive my Part D benefits for my 8 daily medicines. But when I hit the donut hole, for the remaining 6 months of the year, I must pay for both my $85 monthly premium and the full price for my medicines. These drugs cost me $700 per month when I'm forced into the donut hole. And again, this is $700 per month on top of the $85 monthly premium I must pay for half of the year. I am forced to pay these premiums while receiving absolutely nothing in return. Why do I keep paying these premiums? Under the Medicare Part D rules, if I stop paying my premiums, I am out of the program for the next year. The donut hole sure seems like a sweetheart deal for the big drug insurance companies. When I look around my friends and neighbors in Prince George's County, Maryland, I see so many of them struggling. Health care keeps costing more, while medicine and private insurance keep covering less.
This is unacceptable and undignified. That's why we need to reform the health care system now. We will lower costs for consumers in a number of ways, ending co-pays and deductibles for preventive care, putting a cap on out-of-pocket expenses each year, and ending rate increases based on pre-existing conditions, gender, or occupation. We will also restore a sense of stability and peace of mind.
After being denied coverage by 3 companies, I became uninsured on May 1st, 2008. Since then, I've had to postpone some of my annual exams and opt against trying new and potentially more effective epilepsy medication, and also seek charity care from others to just maintain my current health status. I have to say my medication was $900 a month, which, well, that's another shocking fact. But anyway, this health care reform bill will help us by getting rid of exclusions based on pre-existing conditions. It will set up an exchange where we can easily shop and compare plans, and setting standard benefit options to plug holes in coverage that could leave us paying tens of thousands of dollars if we get sick. This bill gives us a reliable option for coverage in the form of a public plan for health insurance companies, if private health insurance companies fail to meet our needs as they have so far.
Because of rising costs, 1 in 5 employers will stop offering health care benefits in the next 3 to 5 years, which means 11 million Americans will lose their employer-sponsored health insurance by 2019. You heard it here firsthand. A job and health care go hand in hand. They are synonymous in this economy.
Instead of spending more than 10% of my payroll in insurance coverage, I could save more than $11,000 by paying 2% and allow my employees to buy the coverage they want in the exchange. At least 2 of my employees would qualify for affordability credits to help pay for their coverage. But these employees are like part of my family, and if I choose to continue to provide coverage for them through the exchange, my business will qualify for a tax credit half the cost of the coverage. In closing, I want to make one final point. As a small business, the cost we truly can't afford in health care is the cost of doing nothing.